Welcome to WPA, whatparentsask.com. If you haven't already, do subscribe to our YouTube channel by clicking here. Hi, I'm Dr. Debmita Dutta. I'm a parenting consultant and the founder of the website whatparentsask.com. And this is video 5 of the 8-part exercise in pregnancy series that we're doing with yoga instructor Shyonee Mitra. So before you begin and follow the exercises that we've shown you in these videos, do check with your doctor to be sure that you can begin and follow these exercises. Never jerk a movement and never stretch to the point of pain. Always remember that the exercises in pregnancy are done to make you feel relaxed and happy. You should not feel fatigued or in pain. So during pregnancy, there's a lot of strain on your back and on your pelvic floor, and so it's important to do exercises to strengthen your back and your pelvic floor. However, it's very important to check with your doctor that you're allowed to do these exercises that strengthen your back and your pelvic floor. If you've undergone certain medical procedures or if you have certain medical conditions, you may or may not be allowed to do some of these exercises. Skip these exercises on days when you're feeling tired, and always do these exercises in the presence of another person whom you can hold on to if you're going to topple over. Remember, your center of gravity is displaced and there are greater chances of your following. So never exercise alone. Always do these exercises in the presence of another person who can hold on to you if required. So the first set of exercises are the squats. These are some of the best exercises to strengthen your back. So in the typical squats that you normally do, you would go completely all the way down and squat on the floor. I would not recommend that during pregnancy because of your shifted center of gravity. You may topple over, fall backwards or sideways if you're trying to do that. So Shyonee is going to show you a modification of the squats in which she's going to sit on a stool. You could sit on a sturdy center table, not a glass one, a wooden one or a metal one, which will take your weight. Test that first. And so do the squats and sit down on that surface. She's going to sit on a stool. Also remember that the most important thing in squats is that when you sit back, your knees should not cross the toes. Do 10 repetitions of this exercise. The next exercise is the pelvic tilt exercise. So the pelvic tilt exercise is one of the most important exercises. The normal orientation of the pelvis is that it's tilted slightly forward. In the pelvic tilt exercise, we're tilting the pelvis a little so that it straightens up and then taking it back to its original position. So the classical way of doing the pelvic tilt exercise is by lying on the floor. But when you're pregnant, after the second trimester, through the second trimester rather, you're not allowed to be on your back for too long because it obstructs the blood circulation to the baby. So she's going to show you a modification of the pelvic tilt exercise that you can do while you're standing up, using a wall at the back. During this exercise, what you're essentially doing is eliminating the gap between your back and the wall. So you're going back, touching the wall fully from the shoulders to the glutes and coming up. So Shyonee is doing a great job of straightening her back and tilting her pelvis, but many of us may not be able to do it so well. So for us, an easy way to bring the back close to the wall would be to bend the knees slightly. So bend, touch your back, straighten up. Bend the knees, touch the back to the wall and straighten up. The next set of exercises, it relaxes your back and it removes the arch. So because of the baby in front, you tend to arch forward. because of sitting in a V position and bending forward, you reverse that arch and that makes you comfortable. The legs are placed in a V to allow you to bend forward in spite of your baby bump obstructing your movement. In the first modification of the exercise, lift the arms until you're sitting straight up, fully stretched. Bend forward as far as you can go and then straighten up to the original position. Lift the arms up until you're sitting straight up, fully stretched. Bend to the side as far as you can go to the side and then straighten up to the original position. This is a modification of the first exercise, except that you're bending. Do this 10 times. The next exercise is sitting and rotating your body. Sit in a cross-legged position on the floor if possible. If not, sit upright in bed. Turn your body by twisting your spine such that your left hand comes to your right knee and you face backwards. Then turn to the front and come back to the neutral position. Do this on the other side as well. Repeat this exercise for 10 repetitions. This is a great exercise to help you relax your spine. Do it only as much as comfortable. Shyonee, of course, is very flexible, but do it as comfortable. And then we move on to rotating the body in the clockwise and the anti-clockwise positions. This is another exercise that relaxes your back and shoulder girdle by opening out your spine. Sit up straight, place your hands on your knees and then rotate clockwise. Rotate as comfortable to you. And do this for 10 repetitions. Place your hands on your knees. Start rotating anti-clockwise. Rotate anti-clockwise for 10 repetitions. Do not go too far back. Do not come too far in front either. The last set of exercises are the exercises for the pelvic floor. These are called the Kegels exercises and most of us have heard of it, but we do not know how to do it. So look, first knowing what the pelvic floor is most important. The pelvic floor in the case of a woman has the urethra opening, the vagina opening and the anus opening. In order to do the pelvic floor exercises, you need to do exercises do movements that you would classically do to hold urine in when you're feeling like urinating and to hold wind in when you're feeling like passing wind. So this has to be done in a slow set and then in a fast set. When you're doing the fast set, contract and relax the sphincter of the urethra multiple times. You can do this up to 10 times. It's an action that helps you stop the urine. So this is something that you have done several times. Just do that action. No one needs to know that you're doing this action. The next exercise is the elevator exercise where you contract the urethra as if you're holding in urine. Then you contract the anus as if you're holding in wind. And all this helps you to elevate the entire pelvic floor, and this is called the elevator exercise. This can be done 10 times. Do check with your doctor before you do this exercise to confirm that you're allowed to do this exercise. Depending on the status of the pelvic floor and on the procedures that you may or may not have undergone, you may or may not be allowed to do this exercise. So that's all in the strengthening exercise video. I'll see you in video 6, where we're going to talk about exercises that will help you improve blood circulation. Thank you. Thank you for watching. To subscribe to our YouTube channel, stay with us.